Folks, Professor Finn here, and today we're going to be looking at Chapter 3 in the 6th edition of the Embalming textbook. So let's go ahead and dive in. So, personal health and regulatory standards. Embalming has historically encompassed principles and practices that are part of public health. The embalmer, as a sanitarian, grew out of two 20th century situations. The first is the pandemic flu of 1919. Disease pandemics are not something just held to the modern world. Most embalming was also performed at the residence of the deceased. So the primary role of the embalmer during this time was to clean and sanitize the sick room and tend to the dead individual. Current understanding of the transmission of diseases is as important then as it is now. The sobering impact of the COVID pandemic has so far claimed 4.5 million lives. The Delta variant, which appeared to have been more contagious and more severe than earlier versions of COVID, threatens to claim even more lives. And residual health effects continue to be felt by individuals who have undergone COVID infection. In light of this current pandemic, embalming protocols for contagious and infectious diseases have been dramatically affected. As with all emergent diseases, the influx of new information challenges us to stay informed and up to date. And granted, here we are in 2024. Even now, the embalming textbook is showing a little bit of age and is likely going to be refreshed sometime soon. That we have a better understanding of what COVID is, we have better treatments for COVID, etc. So a lot of the protocols that were in place between 2020 and 2022, we're kind of getting back to a sense of normalcy, at least pre-COVID normalcy. The unembalmed dead human body is a reservoir of potentially harmful agents that pose a pathogenic risk to the living. The process of sanitizing and preserving dead human remains raises a number of health considerations for individuals engaged in embalming and final care procedures. An embalmer has an ethical responsibility to protect others who come into contact with the deceased. So right off the bat, human remains must be properly treated with chemicals designed to reduce the risk to pathogenic agents and to stabilize the body from further organic decomposition. And always exercise universal precautions during any type of contact with unembalmed bodies and when providing care for embalmed remains. Wear personal protective equipment, PPE, appropriate to the task. Safe work practices and engineering controls are reinforced to reduce the exposure levels to formaldehyde and other hazardous chemicals during embalming and final care of the body. So first up, adequate and properly operating air exchange systems. The exhaust ventilation should draw fumes away from the embalmer and then provide an ample supply of incoming fresh air. Prevent spillage of chemicals by gently mixing embalming solutions and avoid splashing. Keep the rate of flow valve closed on the embalming machine when not in use and close stopcocks and arterial tubes when not in direct use. And as we go, if I notice little spelling errors or typos, I will be making a note to fix those after. Keep your embalming machines in good repair. Make sure you're not seeing any leakage from within the machine apparatus and no leakage, especially no leakage from where the hose attachments are made to the machine or arterial tube. You would be surprised how cheap some people can be. Well, you don't want to be that one firm that's using the same hose for the last 15 years. As the hose is showing its age, dispose of it. Hoses are relatively inexpensive, and that is especially true if you're looking at slip hub type older machines where you don't have to worry about high pressure hoses or quick releases or anything like that. You just jab hose onto the end of the machine. And if you don't want to deal with high pressure hosing and some of the expense that comes with that, you can buy the proper attachments for said very inexpensive vinyl hosing so that you can have the benefit of quick releases, etc. So always rinse fluid bottles and empty residual chemicals into the arterial solution. You shouldn't leave anything into the bottle because then it has to be disposed of with regulated waste. If you rinse your embalming bottles, you may dispose of them in your general trash. cap all chemical bottles even after you have used them and you have rinsed them. There still might be residual vapors in there. And keep a lid on the embalming machine tank at all times except when you are filling it. And even then, you may wish to move the lid aside a quarter of the way or something of that nature so you're not exposing the entire tank to the open air. In the use of continuous aspiration of body cavities during the injection of the autopsy body is recommended, and we'll be talking a lot about that in the chapters where we discuss autopsied bodies. Clamp all accessible leaking arteries during the injection of an autopsied body and restrict drainage as much as possible after blood discolorations have cleared, because this helps retain embalming solution within the body and lowers the volume of chemicals placed into the waste system. In the last lecture, we talked about that capillary function where we have basically lawn soaker stuff going on. Well, the way that happens is through pressure. And if you are restricting your drainage, you are holding as much pressure in there as possible to allow much more of that stuff to penetrate later. And once you have gotten rid of blood discolorations, livor mortis, you really have no excuse not to want to create some of that pressure to increase that lawn soaking effect so you're getting better penetration of that fluid. And also, since fluid takes the path of least resistance, that if you do have a blockage, say right here, what will end up happening is the fluid's going to want to go there with much less going down the blocked area. Once this fills up, finally we'll have more fluid flowing into this area because it has to. So by restricting our drainage, by clamping off arteries, especially in autopsied bodies during injection, we will force the fluid into these other areas where the fluid might not otherwise want to go or go well. You could use closed drainage. You could attach the tube to the drain tube or use direct heart drainage with a trocar. And what this means is as we are taking our drainage, it is going right down the drain. It is not coming onto the table and then flowing down. It's just one more step that you can take as a professional embalmer to reduce your risk of any sort of contagion. And if you are using a waste sink, make sure you cover that with plastic so that you are avoiding splashing and other aerosolization of the contents of what are being emptied into the flush tank. Always maintain running water to flush any sort of debris, organic material off the table and down into your drains. Don't go in guns blazing with high water pressure. You just need enough for the water to flow. That way it's not splashing and getting on all sorts of places. And everything together, combined with your PPE, will greatly reduce your exposure to both formaldehyde vapor as well as other potential hazards. In 1996, a Centers for Disease Control and Prevention study reported that there is ample reason for concern about the exposure that embalmers may have to bloodborne and airborne pathogens. A notable exception to the association between occupational socioeconomic status and tuberculosis was the occupation of funeral director. Even though this occupation was included in the highest socioeconomic status category of executives, administrative, and managerial occupations, 16 cases were allocated to this occupation where only 4.1 were expected. So in other words, as our socioeconomic status increases, the likelihood of catching things like tuberculosis, etc., should be decreasing. And instead, even though we are in that higher level of where, quote unquote, we should be as funeral directors, our occupational risk is much higher than other people in that same category. The CDC thusly concluded that funeral directors have an elevated risk of contracting tuberculosis as a result of their contact with dead human bodies. As such, the conclusion is that embalmers have a greater exposure to tuberculosis than other funeral home employees who do not embalm bodies. A study in 1998 found 101 out of 864 funeral home employees who volunteered to be tested reacted to a tuberculin skin test. It was determined that funeral home employees who engaged in embalming were twice as likely to have positive tuberculosis skin tests when compared to individuals who did not embalm bodies. And tuberculosis is contagious. So if you have it and you are then going home and being with your family and going out with your friends, you are spreading it. In 1991, a study was conducted that suggested that embalmers were at risk of acquiring infection as a result of their frequent contact with blood. 89 of 539 morticians who responded to a survey reported contracting infectious diseases attributed to their occupation, and the most frequently reported diseases were hepatitis, skin infections, and pulmonary and skin tuberculosis. The most commonly reported exposure was by skin contact with blood. And how does that happen? Because you're not wearing proper PPE. You're sitting there wearing your shirt with an apron and a pair of gloves. And I've seen the old school embalmers, they're in there with a polo shirt or a t-shirt, wearing a white disposable apron and a pair of disposable gloves. Well, where do you think that skin contact is coming from? Needle stick injuries were far more common than cuts, 39% versus 11%, which makes sense. The only time we're really cutting is when we're using our scalpel or we're doing some type of maybe surgical excision, but any other time we're dealing with hypodermic needles for subcuticular injection of preservative chemical or bleaching agents. Embalmers are twice more likely to test positive for hepatitis B, according to a 1989 study. The study also found that the length of time a person had been working as an embalmer elevated the risk of contracting the infection because you get more comfortable as you work and you take more risks because you're not as careful. Also in 1989, an editorial was published stating that embalmers face much the same risk of exposure to infectious diseases as clinical pathologists. The exposure risk was confirmed when the first documented case of an embalmer being infected with tuberculosis while embalming a dead body was reported in the New England Journal of Medicine on January 27, 2000 by Dr. Timothy Sterling. So what are some other things that we need to consider as occupational risks? The first is multi-drug resistant pathogens are commonplace. MRSA, VRSA, these superbugs. Well, this is happening because as we get better with our drug therapies, the microbes are going to get better because people are not either using those drug therapies accordingly or they're just evolving to beat them. Within a period of 24 hours, people, insects, and animal vectors or foodstuffs can be transported anywhere in the world. This is why if you travel internationally and you try to bring back certain prohibited foodstuffs, you got to chuck it when they catch it. Never before in our history have embalmers faced such a risk of biological exposure. If we wind back 100 years, embalmers were taking care of the things that happened in their locales. Now a person can fly across the globe, be back within 72 hours, and they are bringing back any diseases and contaminants from that locale that quickly. Outside Magazine in July 1999 stated microbes are still the number 3 killer in the Western world. Embalmers should always practice universal precautions when handling deceased human bodies, regardless of their known infectious status. There is a comprehensive list of microorganisms that are antibiotic or multi-drug resistant in your textbooks. This is an important list both from a testing standpoint as well as a personal safety standpoint. So knowing what these diseases are will help you identify them when people are either talking about them or putting their abbreviations in documentation. The choice to continue embalming when you are pregnant is a personal decision made by the embalmer. Now, this is a wide difference from the way it used to be, which is you should not be playing around with this stuff if you are planning a family or you are pregnant. As long as the embalmer feels capable of working in the preparation room and has access to an adequate supply of PPE, she may continue to do so. Now, that being said, a pregnant employee can request a change of work assignment when it is determined to be the best course of action by the employee or as the result of the employee's consultation with their healthcare provider. According to the Pregnancy Discrimination Act, if a pregnant female is unable to perform her duties with or without a physician's note, the employer must treat her the same as any other temporarily disabled employee. Remember, formaldehyde vapor is an absolute known mutagen. If you are going to be working around known mutagens with a developing fetus, you want to take every precaution possible. In the easiest way to limit the chances of a problem occurring is simply to eliminate the risk entirely and not be in there for the duration of the pregnancy. Many of the chemicals used in embalming and the related processes contain components that have been categorized as hazardous substances, and dangers associated with these substances have been very well documented in the health and medical literature that is available to us today. A 1984 study stated that exposure to formaldehyde, particularly formaldehyde vapor, is probably the most significant of the chemical exposures to which embalmers are suggested. And a 1988 study noted that Canadian funeral service workers were more likely to complain about irritations of the nose and eyes than were members of a control group. Many of the chemicals used in embalming are regulated by the state and federal Occupational Safety and Health Administration standards, or OSHA standards. Most notable among the health problems that can result from chemicals in the preparation room are contact dermatitis, skin rashes, eye and nose irritations, and upper respiratory irritations. Since 1987, the United States Environmental Protection Agency has recognized formaldehyde as a potential carcinogen for tumors in the lung, nasal pharynx, and nasal passages. In June 2004, the International Agency for Research on Cancer recognized formaldehyde as a human carcinogen. Presently, the European Union, under its Biocides Directive, is examining the health effects of formaldehyde. The National Cancer Institute released a 2009 report where they found a statistically increased risk for mortality from lymphoma, hematopoietic malignancies, in particular myeloid leukemia. 2010, the National Academy of Sciences disagreed with these findings and requested a new study. The study found no connection between formaldehyde and leukemia in animal studies. Research continues, but a positive link between formaldehyde and leukemia has yet to be established. In addition to the hazards associated with biological and chemical agents, embalmers are exposed to hazards including heat, ionizing radiation, and non-ionizing radiation. Funeral homes must give consideration to the ventilation and temperature in the embalming room. If the temperature of the room is high, an embalmer wearing full PPE will probably have difficulty regulating their core body temperature, will likely overheat, and that can be a problem if you start getting lightheaded. The potential exists for an embalmer to come into contact with a body that has undergone radiation therapy. Institutions that administer radiation treatments monitor radiation levels and will generally not release bodies until they are safe. The potential for adverse exposure to non-ionizing radiation in the preparation room is remote. Exposure to electromagnetic radiation exists with household products such as microwave ovens or computer monitors. And in the modern prep room, you're likely going to have monitors in your prep room so that you can finish your notes right there within the prep room without worrying about contaminating surfaces and things outside of the area. So, regulatory agencies. The issuance of a license to practice mortuary science declares embalming is a practice affecting public safety and welfare and is subject to regulation and control in the public interest. It also states that the preparation, care, and final disposition of a deceased human body should be attended with appropriate observance and understanding, in addition to having due regard and respect for the reverent care of the human body and for those bereaved and the overall spiritual dignity of humankind. It also states that this is a matter of public interest. The practice of embalming merits and receives the confidence of the public that only qualified persons be authorized to embalm in their state of practice. The state code should then also be liberally construed to best carry out these subjects and purposes. In the United States, the practice of embalming and funeral directing is regulated primarily by the legislative institutions of each individual state to oversee the care and disposition of human remains. The Board of Health or Bureau of Vital Statistics, a licensing state board or similar governing body regulate and license funeral homes, funeral directors, and embalmers. Regulatory agencies promulgate and enforce statutory law, as well as rules and regulations governing the disposition of dead human bodies. States also regulate a coroner or a medical examiner and the organ and tissue procurement agencies to take actual custody of the dead human body. They also have authority over the disposition of indigent bodies and the procurement of bodies for medical science. In recent years, federal agencies have come to play an important role in the activities of the funeral establishment and the preparation room. These agencies can include the Centers for Disease Control and Prevention, the Environmental Protection Agency, the Federal Trade Commission, and the Occupational Safety and Health Administration. 4 divisions of OSHA directly affect the funeral establishment: the OSHA General Rule, the Hazard Communication Standard, the Formaldehyde Rule, and the Bloodborne Pathogen Rule. The Transportation Security Administration registers providers as approved shippers for transportation of human remains by common carriers. Anyone who works with shipping bodies, especially by air, is going to be very well familiar with TSA regulations. We will discuss those later on in the course, and they will also be discussed probably in greater detail in things like your merchandising and managing and funeral directing courses at your respective funeral institutions. In 1984, the federal government promulgated a rule governing the activities of funeral directors and embalmers. The rule, which is commonly referred to as the Funeral Rule, was amended in 1994. And the Funeral Rule applies to all states. There are a number of excerpts provided in your book, and they're all centered around preventing misrepresentation. The purpose of the FTC Funeral Rule is to provide transparency with pricing and to prevent misrepresentative or deceptive practices by licensed professionals. At the local level, various entities such as the Zoning Board, Boards of Health, Waste Disposal Board, etc., all have involvement with the funeral home or the embalming facility. Now, going back to OSHA, the bloodborne pathogen standard is administered by the United States Department of Labor through OSHA. The rule is directly applicable to occupations and professions, including funeral service, where employees are exposed to infectious agents. In addition, many individual states have enacted employee right-to-know laws that support or expand the scope of federal OSHA regulations. Whoever is stricter is the one you have to follow. Embalmers must be aware of the duties and responsibilities that are imposed on them by the law and the rules of the various jurisdictions within which they practice. Under the bloodborne pathogen standard, employees are required to conduct an evaluation of their workplace to determine if employees have occupational exposure to infectious agents regulated by OSHA. If such exposure exists, a written exposure control plan must be developed to control, minimize, or eliminate employee exposure. Exposure control plans, which by law must be accessible to employees, it's not good enough just to have them, your employees have to know what they are and obey them, are to be reviewed and updated at least once per year so that changes in personnel, procedure, and/or work assignments can be documented. So whoever is responsible for this, they need to make sure that they are going in, looking at this, and updating it every year. And there's always going to be some cover page or signature page that states the last time this book was reviewed and updated and by whom. As an institution, your funeral home or your business should have a multi-tier responsibility, so in case one employee leaves or is on leave or is sick, there is another person that knows to go in and check for this. In the modern day, you simply put reminders on your calendars in your Outlook or Google Calendar or whatever so that you remember to go look at the book, update it, reprint the sheet, sign it, and put it back where it's supposed to be. The minimum documentation required for an exposure control plan includes exposure determination, methods of compliance, a hepatitis B vaccination, as well as post-exposure evaluation and follow-up, hazard communication, and record keeping. So, exposure determination. Employers are required to examine workplaces to determine if occupational exposure to bloodborne pathogens exists and what types of duties are being performed when that occupational exposure occurs. If occupational exposure to bloodborne pathogens is identified, employees must then list all job titles or classifications which have exposure. So step one, you have to identify all the job tasks that may cause an employee to come into contact with actual bloodborne pathogens. And once you've identified that task, you've got to look at all the categories of employees to see who falls into those tasks. In a funeral home setting, this may include, but is certainly not limited to, embalmers, intern apprentices, residents, removal personnel, any person having direct contact with unembalmed human remains or with any regulated infectious waste materials. So, if you have a funeral director, and your funeral directors are strictly desk jockeys and they never go into the prep room, your funeral directors will be classified differently than, say, the people with the exact same license, a combination funeral director and embalmer, whose full-time duties include embalming the dead. This is why you have to do an analysis of your employees and determine who has exposure, who doesn't, and make sure they get the requisite training. So it's not uncommon, even for the desk jockeys, that if they ever get pulled to help out in another area, you want them trained to make sure that they are as current with OSHA as the people that are working solely in your care centers and your prep rooms. Employers must also identify those employees who have some occupational exposure to infectious agents. This might include, but are not limited to, everyone basically else: hairdressers, housekeepers, maintenance, funeral directors, clerical staff, etc. Employers must identify and list duties that involve exposure to infectious agents. Compliance with the bloodborne pathogen standard is accomplished by the application of universal precautions, engineering controls, and work practice controls. What people should be wearing to protect themselves, the way your building and facility and room is engineered to keep people safe, and finally, the way your people are working in those areas that also keep themselves safe. So universal precautions, the basic premise of universal precautions is to treat all human remains as if they were potentially infectious. By the implementation of universal precautions, the embalmer seeks to prevent parenteral, mucous membrane, and non-intact skin exposure. To seek protection from possible infection, the embalmer will utilize PPE, properly decontaminate infected surfaces. This is why we clean in the prep room. Properly handle and dispose of infectious wastes. If we spill something, something drips, something gets stuck to something, we clean it. And then we dispose of it in the proper receptacles. Apply appropriate measures to control leaks, drips, and spills of infectious materials. Apply proper work practice skills, and properly handle contaminated laundry. Engineering controls are those mechanical systems and devices engineered into the architecture of a building. Engineering controls that are used to provide personal health and personal and public health protection should be examined or maintained or replaced on a regular schedule. The examination, the maintenance needs to be documented. If you didn't document it, you didn't do it. It's as simple as that. The two primary areas of consideration for engineering controls are adequate ventilation and proper plumbing. The purpose of adequate ventilation is to remove contaminated air from the work area and replace it with fresh air. Proper placement of vents for incoming and outgoing air is critical. The outgoing air, the discharge, should be at the foot of the embalming table and below the level of the tabletop. Formaldehyde vapor is a heavy gas. It will want to sink. So by having the vent where everything leaves towards the end of the table where fluid is constantly being pushed down towards the drain, will facilitate it getting sucked out. By having the vent lower than the tabletop, this means it will want to pull it off the table, away from the embalmer, and out into discharge. This configuration provides clean, fresh air in the direction of the embalmer, while contaminated air is drawn downward and away from the embalmer's breathing zone. The number of air exchanges required per hour is determined by numerous factors, primarily the square footage of the room and the nature and scope of room activity. You should always be planning when you are designing your own funeral home or designing a new facility. Where is this business going to grow? You might not need 2 prep tables right now, but you might need that if your business takes off. So if you can scale that into the room, you can then also build in things like your air exchanges per hour and the proper mechanical fans to facilitate not only their needs now, but also in the future. A general requirement for a single table design might be 15 to 20 air exchanges per hour, which is roughly double the minimum of which OSHA requires. A minimum of 15 air exchanges per hour is currently recommended for the preparation room by the National Funeral Directors Association. The minimum by OSHA is 8. The minimum by OSHA is 8. Installation of plumbing devices prevents waste from entering the potable water supply. Examples include vacuum breakers on the main water line leading into the building, vacuum breakers on equipment such as hydroaspirators, maintenance of discharge basins and flush sinks to ensure good working order, a suitable water source for the preparation room, and then your eye wash stations, your drench showers, your hand washing stations, and finally, showering facilities for your embalmers so they can control their personal hygiene. Vacuum breakers installed on aspiration equipment and water lines leading into the funeral home prevent back siphonage of water leading from the preparation room to the water lines in the facility, and all your local and state plumbing codes must be satisfied. We'll explain vacuum breakers again, but if you want to kind of just gauge what a vacuum breaker does, go over to a glass with a straw and then start sucking in the water on the straw. Cover the glass. You'll notice it starts to get hard to breathe in. And then as soon as you open your mouth, you will see that the water gets pulled back through the straw into the glass. It backwashes into the glass. That is exactly what back siphonage is. And when that happens in the prep room, it can contaminate the whole building, make lots of people sick, which is why you have a breaker on the outside of the funeral home, prevents anything from getting into the pipes outside, and then you should also have them in your prep room, so even if something happens in the prep room, it does not contaminate any of the other water lines in the funeral establishment. Work practice controls are common sense steps taken to avoid unnecessary or excessive exposure to infectious agents. Common work practices that contribute to a hygienic environment include hand washing, proper handling and disposal of contaminated waste, avoid splashing, spraying, or splattering, consistent and proper use of personal protection equipment, and other housekeeping provisions. Work practice controls must be documented and enforced. The licensed individuals responsible for doing the activities in your prep room must be holding each other accountable and setting a good example for the apprentices and residents and interns so that they can see that we take these things to heart. Employees must receive training and instruction on proper hand washing techniques, and the sufficient contact time with antiseptic soap and water recommended is 20 seconds. You basically sing happy birthday. A helpful practice is to wet your hands, apply your soap, lather generously, rub hands and fingers together while singing a song that exceeds the minimum time. The CDC recommends using a liquid soap and running water at a comfortable temperature, working up a lather and creating friction between the fingers. Rinsing with plenty of running water to remove soap from the hands. Residual soap can cause skin irritation and chapping, especially when you're about to lock them in to some latex gloves. Then thoroughly drying hands with a disposable towel or air drying. Use of the toweling to turn off manual faucets is a good idea. Once you clean your hands, you don't want to be touching any potential contaminated surfaces so that you would have to repeat the whole process. You must receive training and instruction on the proper use and accessibility of PPE, cleaning and laundering procedures, repair and replacement procedures, everything to do with your PPE. Employers are also responsible to provide a variety of suitable PPE in a range of sizes for all wearers. It is not your responsibility to buy stuff that fits you. It is their responsibility to protect you. That being said, an employer can choose to provide you with the minimum required under law. No one says you have to have a full face respirator with air cartridge or vapor neutralizing cartridges on the side. They can just give you a N95 or an N99 respirator and say, here you go. You may have to get something that you desire for that added level of protection or comfort if the funeral home is not obligated under law to provide those things to you. But at a minimum, they need to provide you with all the disposable garments, hair covers, gloves, gowns, booties, all that sort of stuff to keep you safe in the prep room. PPE is considered to be appropriate only when it prevents blood and potentially hazardous materials from breaching the protective barrier. Gloves for embalming must be of sufficient thickness and provide full protection of the wrists. This is also why you want to be wearing proper sized gloves. Heavier thickness, 13 mil or greater, latex, neutral, neoprene, rubber, or other high tensile strength materials are more durable and provide greater protection. Gloves should be frequently changed throughout the embalming procedure. This is why we double glove. You have a glove that is fairly thick as the base layer. This is to protect you from contamination. It does also protect you from any sort of garbage that may get through the top glove. And the top glove is there to keep the bottom gloves as clean as possible. That way, if you are working in an autopsy case, you're handling viscera, you have someone that maybe died of a condition that caused blood loss from either orifices or from puncture wounds, you are able to do what you need to do, take the top layer off, dispose of those bloody gloves, and put on a fresh layer of latex gloves, examination gloves, to continue working. This is also important because when you are dealing with things like this, you do not want to take something that is on one part of the body and inadvertently bring it and deliver it to another part of the body. This will be especially true when we are working with things like abdominal viscera. There are a lot of microorganisms in the intestines that will cause all sorts of problems if they get to other places and aren't sufficiently killed with disinfectants. The CDC recommends that barrier masks provide protection against inhalation of airborne pathogens and particulates. The mask must cover both the mouth and nose and fit the wearers snugly for full efficiency. The embalmer should wear a surgical cap, bouffant cap, hood, any other head covering. The hair should be tucked in, but it should be tucked beneath the head covering. Again, if something gets on, you're going to be tracking it everywhere. Your forehead, cheeks, and neck should be protected by a face shield. The arms, torso, and legs should be protected by a garment or combination of garments to provide full coverage. There should be protection. There should be protection from splashes to cover your eyes, so you should be wearing goggles or a combination face and eye shield. And your feet should be covered by a suitable water-resistant non-slip type of footwear or water-resistant non-slip shoe covering. I have seen people wear wading boots in the prep room. When they're done, they leave the boots in the prep room. For those of us who might have larger feet, some of these one-size-fits-all shoe covers don't necessarily work with the type of sneakers we are wearing, so you do want to have something that you can use disinfectants on that won't discolor or damage your footwear. A rule of thumb for protective garments is that the embalmer should have no exposed skin. And with all of these things on you, you want to make sure that you have good temperature control because you will overheat very quickly. Disposable PPE must be removed after use and properly discarded in an approved biohazard waste container. Launderable PPE should be properly stored for cleaning and disinfection. Eating, drinking, handling of contact lenses, application of cosmetics are prohibited in these areas where PPE is required. Food items and beverages should never be stored in mortuary refrigeration units. Employers must ensure that work areas are maintained and clean and in sanitary condition. A written cleaning and disinfection log must be implemented. You should be checking it, you should be filling it out, and you should not be filling out weeks and days at a time. Mark the stuff off as you clean it. Keep these things current. Customarily, terminal room disinfection occurs at the completion of each embalming shift or at the completion of the daily work schedule. After use, hypodermic needles and other sharps should not be sheathed, bent, broken, recapped, or resheathed by hands. You should always use instruments when you're dealing with things that can cut or puncture. Dispose of broken and contaminated sharps in approved biohazard sharps containers. Disposable and retractable scalpels are recommended. Now, I can tell you one of my favorite scalpels to use is something called a pen blade. All procedures involving blood or other potentially infectious body fluids should be performed in such a manner as to minimize splashing, spraying, or aerosolization. Blood drainage from the drainage instrument, angular spring forceps, or drain tube must be modified to minimize splashing and reduce aerosolization. Body bridges and various positioning devices lift the decedent off of the table and allow blood and waste to freely reach the table drain without splashing. So by getting the body off the table, organic material can flow right down to the drain. It minimizes odor. It minimizes contamination. Use these things. All sinks and basins should be covered to eliminate aerosolization from splashing. All instruments, equipment, and work surfaces should be properly cleaned and disinfected upon contact with blood and other potentially infectious materials. All pails, containers, and receptacles intended for reuse and those that have a potential for becoming contaminated with blood or other potentially infectious materials should be inspected, cleaned, and disinfected on a regular basis or as soon as possible on visible contamination. Now, the hepatitis B vaccine. This vaccine must be made available to all employees who have occupational exposure. If you do not have occupational exposure, your employer is not required to give you a hepatitis B vaccine. The vaccination program must be offered at no cost to the employee, offered at a reasonable time and place, performed by or under the supervision of a licensed physician or a certified healthcare professional, and provided according to the recommendations of the U.S. Public Health Service. This means the employee cannot spend any money to obtain this. They should not be driving their own vehicle on their own time outside of work. They should be provided transportation to and from. They should be given money to go ahead and get the shot. You cannot reimburse them. If they reimburse, they have spent their own money, and that is a cost. So you should be giving them the money they need for that shot, or you should have a contract set up with wherever you're sending them. And ideally, the best way for you to do this is simply give them a company vehicle while they are at work, go to the facility, get their shot. It is paid for by the company, and then they come back. Employees have the option of accepting or declining the vaccination. If the employee is offered the vaccination and declines, they must sign a declination statement. The inspectors have to know that they were offered the shot and they said no. And if that employee first declines the vaccination and later decides to accept, you must dispose of the declination document or at least invalidate it, and then they must be given the vaccination as if they first requested it before signing a declination. The moral of the story is they need to be offered it. If they say no, if they ever want it, they can get it at no harm, no foul. Prudent practice is to verify immunity levels with a blood test at regular intervals annually or at least every few years. Generally, what ends up happening is these are good for about 10 years, and after 10 years, you just get another shot because the blood test to see if your immunity levels are in place is about as much as the shot, if not more. So you might as well just take the shot. In the event that a blood or body fluid exposure incident occurs, employers must immediately implement procedures for post-exposure evaluation and follow-up. The post-exposure evaluation and follow-up will include a detailed explanation of the unseen circumstances related to the exposure. How did this happen? Identification and documentation of the source individual unless doing so is impossible or prohibited by law. Collecting and testing of the source blood for hepatitis and human immunodeficiency virus. Taking steps necessary to assist in the prevention of infection or disease. Offering counseling and conducting an evaluation of any reported illnesses. It is also prudent then to review your exposure reduction strategies, your workforce plan, to determine the potential for future exposure. How did it fail? How do we need to change things to make sure this doesn't happen? And let's get our people trained on that. So, bloodborne pathogen, communicating the hazards. So we're going to look at another OSHA standard called hazard communication that is something different. This hazard communication specifically refers to how we communicate bloodborne pathogen hazards. The following can be used to label or distinguish containers used to store, transport, or ship blood or other potentially infectious agents. Fluorescent orange labels, orange and red labels, predominantly orange and red warning labels, and labels with lettering and symbols in contrasting colors, or other suitable substitutes for labels such as red bags or red containers. Employers must provide the training at or before the time the employee is assigned a task where exposure exists. Training updates must be repeated at least once per year, annual training. Your book lists more than a dozen components that comprises the training, and all of these are important. So, the employer must give you the training at the time you're about to do the task or before you are assigned the task. You cannot perform the task unless you have been trained on how to protect yourself. This means you can be hired as a removal technician, you can do a week of onboarding at the funeral home, but they don't have to give you bloodborne pathogen training until you're either about to go do a task or they want to get it done early. What they cannot do is have you start shadowing a removal tech, actually going out on the van or whatever it is, and then giving you the training afterwards. Even if you're not assisting, you should not have exposure. This is not about doing a task. This is about potential exposure. So you should not be exposed until you've had the training. Employers are responsible for establishing and maintaining accurate records for each employee with occupational exposure to bloodborne pathogens. The employee must receive training on the date of hire or the date being responsible for a task involving exposure. The date may change as a person's duties change. So, why is this important? Because what if I hire someone as a part-time individual who strictly opens doors and helps out the front end of the business? Later on, they become an apprentice embalmer. If they've had no exposure prior, they would not have needed to receive bloodborne pathogens training. But the moment that they become an apprentice embalmer and they're going to engage and work in the prep room, they're going to have the bloodborne pathogen training. The fact they've been working for you prior is of no consequence. Employers must retain records of each training session, and training records for bloodborne pathogens need to be kept for a period of 3 years from the date the training occurred. Questions involving how long you must retain records are fairly prevalent and very popular because this is what inspectors look for when they are coming into the workplace. And you may go from a rank and file director to a supervisor very quickly, and you will need to know that you need to hold these training records and the written sign-in sheets for at least those 3 years from the date of training. Employers are required to make all records available to employees or their representatives. If either the employment is terminated or the employee transfers to another location or employer, the training records must be made available to the new location or the new employer. If they swap chapels, if they go somewhere else, they should be offered to take their records with them to show their training, etc. You never give away your originals. You never give away your originals. If an employee passes away, or if you have a union workplace, the collective bargaining agent, their legal representative, can receive that information on their behalf. If an employer ceases to operate and has no successor, the employer must call OSHA and notify them so the records can be transferred to an appropriate place and filed for future use should the situation warrant it. Embalmers have to make judgments about exposure to potentially infectious agents. Information is vital to the decision-making process, and embalmers should have access to as much information as possible. Inasmuch as the embalming procedure is invasive, it is given that infectious agents will escape from the body during embalming. The moment we make a cut, things can start coming out. That is what that is saying. The embalmer represents a potential host for the escaped infectious agents because the embalmer will be in direct contact with any infectious agents that are released from the body. In spite of the exposure, infectious agents can be prevented from entering the embalmer with the proper application of work practice controls, engineering controls, and universal precautions. In addition to the controls and physical barriers that can be utilized to protect the embalmer, it is important for the embalmer to maintain good personal health to maintain resistance to infection. If you are sick, you are at an increased risk of getting sick should something bad happen. Decontamination of instruments, equipment, the work area, and the body are important weapons in the fight against infectious diseases. In the preparation room where exposure levels are high, decontamination is accomplished by using physical or chemical means. Good work practices and universal precautions dictate that the instruments, equipment, countertops, tabletops, walls, floors, light fixtures, sinks, cabinets, and waste receptacles be cleaned, sanitized, and disinfected. Disinfection and decontamination should occur as necessary during the embalming procedure. Nothing says you have to wait to wipe something down, especially if you think it's getting dirty. Concurrent disinfection and decontamination and then terminal disinfection and decontamination must be done thoroughly at the completion of the embalming process. A quality topical disinfectant should be applied to the deceased human body, followed by the bathing of the body during the initial steps of the embalming process. It is important that when we are using a quality topical disinfectant, a droplet spray disinfectant, that we read the label and we see how long that disinfectant should remain on the body before we go on to the bathing stage, because that minimum contact time is important in reducing the risk to the embalmer. Concurrent cleaning and bathing should occur during the embalming process. If something is getting on the body, if you have a blood clot sticking to something, you will want to get it off the body and clean it as quickly as possible. Certain materials, especially blood, when they remain on skin, may cause permanent staining. So if you see something, get it off. That way you do not run the risk of forgetting about it later or hoping it's just going to flow down when you do your final bathing. Embalmers should consider steam sterilization or autoclaving for contaminated instruments, or immersion of instruments in a suitable cold chemical sterilant. There are various ways to do this, and one of the most popular ways to use steam sterilization, an inexpensive steam sterilization, is to buy yourself an industry-grade dishwasher with sterilizer like you would use in a restaurant, where you can put in all of your metal instrumentation, put it on a steam sanitized cycle, and that is a relatively inexpensive way to steam sterilize your instrumentation. Autoclaves, true autoclaves, are extremely expensive. So many firms may choose to go with a more inexpensive route, whereas if you were to get an autoclave that could fit a trocar, you may be spending at a minimum somewhere around $18,000 to $35,000. Whereas if you were to buy an industry-grade dishwasher that you would use at a restaurant, you might spend around $2,000 to $3,000, which will then easily fit a trocar. Steam sterilization is seldom used in funeral service because of two considerations. Like I just said, autoclaves ain't cheap, and autoclaves are typically not large enough to hold instruments such as a trocar. My previous employer purchased an autoclave for us to use for this purpose, for keeping our instrumentation sanitized, so we have a safe work environment. The base unit itself costs $65,000. Forget installation, forget maintenance, just to get it into a crate to start shipping it to you is a $65,000 price point. And fun fact, there are some materials out there that are not safe for autoclaving. So you will want to look when you are purchasing equipment for your embalmers to make sure that it is safe for autoclaving. And if it does not say it is or isn't, you will want to ask, as a general practice, if it has lacquer on it, like old bone separators. That is not safe for autoclaving. The autoclave will melt it. Embalmers will find a number of commercially prepared cold chemical sterilants on the market. They typically contain glutaraldehyde or formaldehyde and methanol as their active ingredients. And when you are using these cold sterilants, again, contact time is important. You must thoroughly clean your instruments, and then when you place them in the sterilant, you will need to leave them there for the recommended time, usually 2 to 3 hours, depending on the potential contaminants you are looking at. This is why most funeral homes will have 2, maybe even 3 full sets of preparation gear, so if you do have a contaminated body that requires a full 3-hour disinfection, that you're able to put those into the drip tray and then continue working throughout the day because you have spares. When corrosive disinfectants such as household bleach are used, chrome finish in instruments can be damaged. It may nevertheless be advisable to use household bleach if you have Creutzfeldt-Jakob disease or other prion-based disease that is being embalmed. So again, you can use bleach, but expect some damage to your metal equipment if you do that. Anytime instruments appear to be pitted or the chrome finish is worn away, the instrument should be replaced. When an instrument is pitted, when the chrome is worn away, the surface becomes difficult to disinfect. Little pockets, little microscopic bubbles can form in these areas. And what ends up happening is when there is air and the decontaminant cannot get to it, the microbe in there flourishes. When you then use that instrument again, you are then transmitting that contaminant to a new cadaver, and you as the funeral home are liable if you transmit a infectious disease from your equipment to a new cadaver. You do not want to transfer a C. perfringens infection to a cadaver that does not have that. Pitted surfaces are ideal hiding places for microorganisms and also permit air bubbles to build up between the disinfection solution and the surface of the instrument, as I just stated. Your book also references a squeegee effect, that if by chance you puncture your glove with a sharp, that if it is a chrome-plated surface, your glove will act as a squeegee, pushing things back. If you have a pitted surface, there might be microorganisms and you are pushing them directly into your skin. Topical disinfectants are used either for the sanitation of skin and the hair of the dead human body's external orifices or for the sanitation of exposed tissues as a result of trauma. These chemicals are also used to disinfect body bags, clothing, medical devices, and protective garments removed from the body. Now, this is an important thing to note. Your book advocates, as did previous editions of the book, that you are to take a topical disinfectant and spray down things like body pouches, disaster pouches, etc., before you dispose of them in regulated medical waste so that you reduce the risk that it becomes a major problem. Finally, instruments, countertops, embalming tables need to also be sanitized with a good topical disinfectant. If you're using things like plastic visors, okay? So not the disposable ones, but the reusable ones, like a safety mask. It is important that you not use Lysol on those sort of things. When you spray Lysol on the plastic, Lysol will actually melt the plastic. This is why when you are Lysoling items and wiping it down over time, they become cloudy. Because what you're doing is you're actually melting the plastic and it is causing that cloudy appearance. If you are using reusable face masks, okay, face shields, the best thing that you can use on that to clean it is good old-fashioned dishwashing soap. Plain old Dawn dishwashing soap is one of the best cleaners for things like reusable face shields, and that will help keep that face shield crystal clear for a while. So don't use Lysol wipes, don't use Lysol spray, just use literal soap and water. Disinfectants need to be broad spectrum, meaning they can kill just about anything, bacteria, funguses, viruses, and ideally tuberculoidal as well. Read labels carefully when working with disinfectants. You want to obey times for usage and what they should and should not be used on. Chemicals are dated. This needs to be noted. If the chemical is out of date, that means it is likely not as effective as it should be. And there's that period of time in which the chemical needs to be in contact in order to do its job. Know what that time limit is. Areas to be treated should be cleaned with soap and water first. Remove as much garbage as possible before you put the spray on there. And the reason for that is if you drop a bloodied aneurysm hook into your drip tray, there is garbage on there and you are disinfecting the blood, which is making it less effective over time. So clean everything, drop the stuff in there and let it sit the appropriate amount of time. Remove and then dry it, preferably with disposable towels. Okay, that way when you're done, you just chuck the towel and it's a non-issue. Otherwise, you have to deal with making sure that your laundry is properly stored and decontaminated. Now, you might say, oh, Professor Finn, you just said to clean it and then spray it. Well, when we're looking at the dead human body, the rule is to spray the body down first, give it time to work, and then bathe it, which seems to be contraindicated here. And the answer is no, it is not. When you do that initial disinfection, okay, what is happening is you are spraying the body down with this droplet spray. This is misting and moistening the surface of the body, and any contaminants that might otherwise be aerosoled into the air around it are now being stuck to the body, so that in the 10 minutes, the 12 minutes that it's going to take for this chemical to work, when you come back to clean the body, you do not run the risk of you actually blowing any of these dry elements up into the air, getting on your PPE, coming into your contact with any potential skin that may be out there, if you're not wearing a full head cover, getting into your hair, etc. So the goal is, yes, to kill microbes, but it's also to keep the microbes stuck to the body before you actually bathe. Remember, go back to your hand washing. The first thing it says is wet your hands and then use the soap. Why? Because by wetting your hands, things will stick to your hands, and you're not aerosoling them as you're moving your hands around. A good topical disinfectant for which should be effective against tuberculosis, Staphylococcus aureus, HIV, herpes, hepatitis, MRSA, and VRSA. Very important that you're using something that they would want to use in a hospital. You shouldn't be just going out buying a bottle of Windex at Walmart and then spraying and hoping it's, it looks the same color as the other stuff and it's a heck of a lot cheaper. It's not the stuff you want to be using. So the qualities of a good topical disinfectant. 1, it's active and has a good shelf life. You should not buy this stuff and it falls apart 3 days later. It does not corrode or stain your instruments or your countertops. It's effective against a wide range of little bugs. It destroys microbes in their products quickly. The sooner it gets them killed, the sooner you can work. It's a good deodorant for the body. It doesn't bleach or stain skin. It is not irritating to the embalmer's skin or respiratory tract, and it's not inactivated by the presence of biological debris. So if you are spraying it on the body and maybe surface sweat, spit, blood, feces, whatever might be there, deactivates it, it's kind of pointless for you using it. So now we're going to step away from bloodborne pathogens. The next thing OSHA drops on us is something called the Hazard Communication Rule. The Federal Hazard Communication Rule requires that employers communicate to employees the dangers that exist in the workplace as a result of hazardous substances or materials, and then directs the employers to train employees in the safe use and handling of hazardous substances or material. Professor Finn, they just said that. Remember what I said? Hazard communication before was strictly about bloodborne pathogens. Now we're going to talk about everything else. Alcohol, phenol, formaldehyde, carbolic acid, which is phenol, I just said it. Now you're going to learn about everything else. Under the hazard communication rule, any chemical or a mixture of chemicals that expose employees to a health or physical risk are considered to be hazardous. Mixtures of chemicals with a composition of 0.1% or more of an ingredient classified as a carcinogen, teratogen, a mutagen are considered to be a physical or health hazard. Mixtures of chemicals with a composition of 1% of an ingredient, which although is not classified as a carcinogen, teratogen, or mutagen, but are classified as a hazardous substance, are considered to present a physical or health hazard. So if it is a carcinogen, teratogen, or mutagen, 0.1%. If it's anything else and still a hazardous substances, it goes up to 1%. Information about the hazards of using certain materials or substances are provided by safety data sheets. Prior to 2012, these were called material safety data sheets. Now they are called safety data sheets, SDSs. So you get information from the SDSs, you get it from the labels on the bottles, and you get it through proper training. So first up, safety data sheets. The hazard communication rule requires manufacturers, suppliers of materials or substances to include a safety data sheet with each shipment. The safety data sheet contains critical information relating to exposure levels and symptoms associated with the material or the substance. A safety data sheet must be kept on file for each hazardous substance or material present in the work area and must be accessible to employees. Now, you are permitted to have electronic safety data sheets in one room as long as you also have print safety data sheets in another. What this means is you could keep PDF safety data sheets on a computer or a tablet in the prep room, and then you also have a physical binder with these same safety data sheets in the manager's office or the care center's office or something like that. So you have access to both of them. All containers that hold hazardous substances will be properly marked with the name of the product as it appears on the safety data sheet. So if you are mixing something or doing something, you will know exactly what's in that bottle, and if something should happen, they can call the proper people to determine how to neutralize it or seek proper medical attention. To be in compliance, any carton of chemicals containing hazardous materials or hazmats needs to be appropriately labeled on the exterior of the box, making it clear what the case contains. Ideally, a safety data sheet will be found in the carton. Because it is likely that each individual bottle of chemical would be removed from the case and stored separately, each bottle also needs to be clearly labeled. This is why we don't just get one box of Metaflow. Metaflow is a co-injection. Let's go for something with more spice. Let's do Permafix. This is why we get a case of Permafix, and there should be a safety data sheet in the box with the 24 bottles, and each one of the bottles is labeled Permafix with some minimum information so you can identify which manufacturer, supplier, and find a safety data sheet if you needed it. The hazard communication rule mandates that employers develop a training program that meets all the criteria listed in your book. Again, it is quite verbose. The employer must be able to identify the hazardous substance found in the workplace by their generic, chemical, trade, and or common names. So, for instance, carbolic acid is also known as phenol. You would want to know all of the aliases for carbolic acid during a training. You must then make all of this known to the employees who may potentially have contact with the identified substances. And you must train the employee on hazard communication upon initial hire and then annually. You don't get a time period to get them trained. When you hire them, they must be trained on all the hazards in the workplace, essentially on day one. And then every year, you must retrain them. Employees must identify hazardous substances exposure levels with trigger restrictions. There are standards that mandate certain protective procedures and safeguards be put in place when the exposure to a hazardous substance approaches, reaches, or exceeds a level that has been determined to be harmful or injurious. Later on, we'll be discussing something called exposure limits. And I'm going to teach you to draw a little graph like this. And you're going to be making little notations. And then you're going to know what this stands for, what this stands for, and what this stands for. And ideally, you'll also know what this stands for. Because in one, you are compliant. In one, you need to do something, and it's a warning sign, because things are getting bad. And when you finally get up to here, now you have bad things. When you are in this element, life is good. There's not much you need to do. Keep on trucking. When you're here, well, now you need to be taking steps to reduce some things. And if you make it to this level, now you're doing all sorts of extra things. The employer must identify the routes of entry and acute or chronic effects of exposure to hazardous substances. The employer must also explain the symptoms that accompany the exposure, and the employer must identify and explain what other dangers associated with hazardous substances to which the employee is exposed. You must maintain emergency treatments that will be employed if there is an exposure incident. You must explain the proper use of handling those substances. The employer must explain cleanup procedures. They have to provide the name, telephone number, and address of companies that supply the workplace with those chemicals that are considered hazardous. All of this information, folks, is on a safety data sheet. So by having the safety data sheet, giving people training, giving them the overview, knowing, telling them where to go, direct them to the places to find the information, that's going to go a long way to keeping your employees safe. Above all else, this is why we have mortuary school. You're getting hit with this before you might ever enter the workplace. You already have an idea of what you're walking into, and that way the training is continually reinforced. The employer can easily satisfy this requirement by referring to the manufacturer's information on the safety data sheet. The employer must inform employees of the existence and location of the written materials related to hazardous substances that are found in the workplace. In addition, the employer, upon request, must provide access to the copies of training materials for the employees, representatives of the employees, or the regulators. In other words, it's not good enough just to have an iPad and a binder. Your employees need to know where the binder is. They need to know where the tablet is hiding. You're going to want to make sure that tablet is charged. So the formaldehyde standard. Employers must monitor employees to determine how much exposure to formaldehyde exists in the workplace. Studies have shown that exposure to formaldehyde it really mess with your eyes, nose, throat, and upper respiratory tract. In fact, at certain levels, formaldehyde vapor is immediately dangerous to life and health. It will kill you if it crosses a certain threshold, which is why you never want to get that close to it. Exposure monitoring is accomplished by sampling the air in the workspaces where formaldehyde is used. Exposure monitoring is intended to determine if the level of exposure to airborne concentrations of formaldehyde in a work area is at or below a specific concentration. The formaldehyde standard establishes specific limits on the exposure that is allowed. The specific point at which an 8-hour exposure is unsafe is called the action level. It's called the action level. And that occurs at 0.5 parts per million. So, let's talk about that graph I was just talking about. We're going to have our 8-hour test. We're going to have our 15-minute test. Both of these start at 0.0. So now we know at 0.0 to 0.49 we are in something called compliance. But the moment we get to 0.5, we are now at something called the action level. If sampling determines the action level has been reached or exceeded, the employer must take required steps to reduce exposure. The purpose of requiring exposure reduction at the action level is to ensure that exposure does not reach the permissible exposure limit, or PEL, also called the time-weighted average. Okay, I disagree with the book here. The PEL is not an AKA for the TWA. The permissible exposure limit is a permissible exposure limit. The time-weighted average is the name of the test. The permissible exposure limit sets the maximum average exposure over 8 hours that is allowed by OSHA or state governments. And there are two types of tests that must occur in every funeral home. The first is a time-weighted average, and the second is the short-term exposure limit. So if we draw our chart, we now have something called the time-weighted average and the short-term exposure limit. This is 8 hours. This is 15 minutes. We have compliance. That is 0 to 0.49. Now we have an action level at 0.5. The tests are to be conducted in a worst-case environment. The testing should be done at a time when there's an embalming taking place in the prep room during your busiest shift. So if you have 3 shifts a day, you run a prep room 24 hours a day, you determine what your busiest shift is, and that's the 8-hour shift that you perform the test, or the individual, the company, the vendor comes in to perform the test for you. When test results document worst-case situations that are within the limits specified by OSHA, it is reasonable to conclude that the air quality is acceptable at all other times. In other words, if during your busiest shift, when everything is hitting the fan, you are in compliance, you're probably in compliance at all other times. If the results for a sampling for formaldehyde indicate the exposure is below 0.5 ppm, you're in compliance. I don't like the way this is worded. The action level has not been reached. You're in compliance. Okay? This is why you want to get in the habit on every piece of scrap paper in every one of your classes going forward, you start drawing out this chart. And you literally write in things like compliance, action level. And here in a second, we're going to have the violation of the permissible exposure limit. And then you're going to do the same exact thing over here. So when do you have to test? You must test whenever an employee reports symptoms associated with formaldehyde exposure. You must go in and redo a test. And if there are any changes in procedure, equipment, chemicals, personnel, or other circumstances that affect the work area. Now, this is not very well defined other than what you see here. Largely, this means a change in licensed personnel that work the room. You hire a new embalmer, you want to make sure that embalmer is as compliant as the rest of them. You get a new embalming machine. You change out the ceiling fans. You get a new air conditioning system. You open or close, wall off a door. That might be something that you have to retest on. Just because you went from Permaglow to Permaglow 35 is not necessarily a new chemical. It is still formalin solution. It is simply a different quote-unquote flavor of formalin solution. That might not necessitate a retesting of the area. But if all of a sudden you start using, say, paraformaldehyde, and you've not normally kept or ever used paraformaldehyde in your prep room, just because it's based off of formaldehyde, paraformaldehyde is a different chemical than formalin solution. You would need to train with that new chemical in the building. You might say, Professor Finn, this is really, confusing. Remember, the formaldehyde rule is not meant for funeral homes. It is meant for all industries that deal with formaldehyde, including plastics. So we fall under this just by bad luck. And we have to comply with the same exact things as plastic manufacturing, nail salons, etc., because they are using formaldehyde in what they do. If the time-weighted average sample reveals an exposure that exceeds the short-term exposure limit or permissible exposure limit, the employer is required to implement steps to reduce the exposure. They then have to place signs on the doors, begin medical surveillance, and do all sorts of stuff. Now, medical surveillance is defined as you have to have a questionnaire filled out by the employee that is then reviewed by a physician. The physician can recommend the employees having no ill effects should return to work, or they need to send that person off to get a further examination. If they're given a medical examination and the physician then recommends that there's no health problem present, that employee should return to work. If a health problem is present, the physician can recommend medical removal. If medical removal is ordered, the employee is out of the prep room for up to 6 months. If there is improvement in the condition of the employee, the physician can release the individual back to work. The employer cannot compel that. If the physician wants that person sitting out, the employer cannot make the employee go back to the prep room without physician approval. If the medical condition of the employee does not improve, they can either be reassigned permanently or the employee may be terminated. If the employer elects to terminate employees who are medically unable to perform the task and duties for which they were hired, you're probably going to be looking at a workman's comp complaint. So you're going to be making this decision and determining which way you want to go. Now, in those cases where the time-weighted average sampling reveals 0.75 parts per million or higher, the permissible exposure limit has been reached. I think it has been breached. So now we have one of the final components of that top portion. We have 0 to 0.49. We have 0.50 to 0.74, and then we have 0.75 to infinity and beyond. This is our time-weighted average. This is our 8-hour test. Here's compliance, here's the action level, and here's permissible exposure limit. We're going to ignore this line for right now. It's in the wrong place anyways. Okay? So we are either in compliance, we are in the action level zone, or we have exceeded the permissible exposure limit. The moment we get to permissible exposure limit, signs go on door, medical surveillance, and respirators get handed out. Not N95, formaldehyde neutralizing respirators. That face mask you've always wanted, now they're going to have to give it to you. Until they get to this, they're not obligated to give you a Vader mask, okay? Whether that be the painter's mask or the full face shield. They're not obligated to get you one just because you work in a prep room and you are around formaldehyde vapor. They're only obligated to give you one of those once you exceed 0.75. You exceed the permissible exposure limit. Employers and employees should be aware that OSHA has a respirator standard that must be followed when respirators are put into use in the prep room. So if you are voluntarily putting this into your workplace, you must comply with the OSHA respirator standard. If you breach the permissible exposure limit, you must comply with the respirator standard. The two major provisions of the standard are: 1, the employee must be fit tested to see if a respirator is appropriate for them. In other words, they get a custom fit one. You don't get to buy 3 large ones and people just have to figure it out. Personal respirator must be fitted to each individual employee and must be refitted regularly. If they gain weight, they lose weight. You must make sure that that respirator is working appropriately for them. So first, can they use the respirator you are requesting? And second, are you making sure that that is fit to them and it is doing the job as intended? So short-term exposure level. In addition to the 8-hour test, you must do a 15-minute test while you are actively embalming. Right? So we have the time-weighted average, 8-hour. We have the short-term exposure limit, 15-minute. We have 0 to 0.49. We have 0.5 to 0.74. We have 0.75. So here's our PEL. Here's our action limit. Here's compliance. Now on the 15-minute exam, we have compliance to 1.9 parts per million. And now we have a violation of the short-term exposure limit, which is basically the same as our STEL. It's the way to kind of get this in your head. You violate the PEL, you violate the STEL, you do the same exact things. If the sampling reveals a concentration of airborne formaldehyde below 2 parts per million, you are in compliance. Okay? You are in compliance. And the same rules apply until someone reports a symptom, until you change employees, you change something in the room, you get new equipment, you are in compliance, and you do not have to retest. Now, I have yet to see a single piece of documentation from the formaldehyde standard that says you must retest annually. That is usually a best practice. That is something that is recommended. But according to the standard, the best I can see, you must retest only when people report symptoms or there are changes that we've already discussed. If you cross that 2 part per million threshold, you must do the same exact things as the PEL. This is why I list them exactly as I do. When I draw the box, I make sure that those two things are the same so you can visually see where things are. And if something crosses over here, you must do the same exact things for either of them. Now, I've got a 35-minute video that just talks about drawing that thing out. Feel free to go on the YouTube channel, Formaldehyde Exposure Limits, and watch that video. Okay? Periodic testing means that employers must retest the work area at least every 6 months if the exposure is over the action level, and every 12 months if it is over the short-term exposure limit. So, if we are crossing the thresholds, right? If we go into this zone or we go into this zone, if you are violating anything here, okay, the action level, this is going to be a 6-month retest. And if you are over the PEL or the STEL, it is going to be, I'm sorry, if it's the STEL, it is going to be a 12-month. Why? If you are compliant here, this is a shorter duration of exposure. They want you to fix it, but you have more time to fix it. If you're up here getting busted over an 8-hour test, they want you to get it done pretty quick. That's the moral of the story. Now, if you have 2 consecutive retests, which are at least a week apart, 7 days, and concentrations are in compliance, you can stop the periodic monitoring. Okay? You can stop the periodic monitoring. The reason why you want to drop this chart on every piece of scrap paper, right, is so when they give you a number, you can go in here and you can very quickly and easily see where it is that this number is. This is in the action level. Now, what people like to do is something like this. You get a 0.64 on the 15-minute exam. You want to make sure that you are looking at the right section. Because a 0.64 up here requires you to take steps. A 0.64 down here requires you to do nothing. That is why it is important that you put this chart on your scrap paper. It is important that when they do a number, look to see where it is. Put it, your ink pen or whatever it is. I think nowadays they give you a whiteboard and a dry erase marker. You put it right in that area so that you see that's where that number goes. And if you do this, you will know exactly where you're supposed to be every single time. Now, whether you remember what you're supposed to do in those areas, that's going to be up to you, grinding through this and doing the memorization. But 90% of the battle is knowing where you are on this chart. And then from there, you can figure out, hey, am I just doing medical surveillance? Am I putting up signs? Or am I also having to hand out respirators? Wear protective equipment when handling chemicals to avoid exposure by contact with skin. Should never be touching bottles without gloves. Exercising care when handling and pouring chemicals to avoid spills. I love seeing people take the cover off and just put the bottle completely vertical and have stuff splashing everywhere. Pour technique is a thing. Get the bottle above the surface, pour it gently, rinse it, cover it, swish it, pour the contents out. Rinse it again if you have to. Be very gentle when pouring your liquids. Handling and pouring chemicals in a way that prevents vapors from escaping into the room. Nothing says you have to take the lid completely off. You can put it to the side, you can pour your stuff in, you can close the lid. Old school people love to just take the lid, drop it on the side of the countertop, just start pouring stuff in. They might even take an aneurysm hook or a large angular spring forceps and then stir the tank and then put the thing back on top and away we go. You know, it's never affected me, it's never hurt me, this is just the way we do it. That is not the best practice and it is not necessary. How much time did you actually save doing that? Minute and a half? 2 minutes? Wow, that makes such a big deal. I'm glad to know that by the end of the day, you doing that 5 or 6 times, that saved you 5 minutes of time. Again, establish a personal standard for yourself. When you become a business owner, enforce your employees to that same standard. Set a good example. Set a good example for the apprentices that are coming into the business. Keeping instruments and equipment in good working condition to prevent spills and vaporization. You want to protect your investment. Embalming machines aren't cheap. The cheapest ones I think that are out there are like $3,500. The really badass new frigid machine, that's like $6,000. And if you want a custom color, it's even more than that. Why would you not want to keep your equipment in good condition? Why would you not want to treat it gently and properly and maintain it? And here it is. Keep the lid on the embalming machine when the embalming solution is in the tank. As soon as you're done pouring, put that lid on and leave it there. Don't take the lid off and leave it on the side of a countertop. Just be like, yeah, don't worry about it. We're far enough away. Again, this is sloppy. This is sloppy work. Recap your fluid bottles. See, a lot of people take the cap, throw it in the thing, rinse it, throw the empty bottle on top of it. There still may be residual chemical in there. And if you're using an appropriate amount of chemical, or you're in a high volume prep center, you may be using a lot of bottles and those vapors might build up. And finally, properly rinse those fluid bottles. Again, regulated medical waste is not cheap to dispose of. Anything you can do to keep stuff in the general trash, you need to be doing from your business standpoint. Continually aspirate body cavities during autopsy embalming. We'll be looking at autopsy embalming later in the course. But in an autopsy, chemical isn't going to flow out an incision onto the table and down. It's going to flow wherever the big hole is that was left where the doctor or medical examiner took the chunks out. So in order to get that out, you're going to have a specialty device we call an autopsy aspirator in there so that it's pulling that formaldehyde fluid out. Otherwise, it's going to pool there and just immediately release vapor into the atmosphere. Control your drainage. Utilize a drain tube. Now, me personal, I am not a fan of drain tubes. I have never been a fan of drain tubes. Some people swear by them. Me, not so much. But there's nothing wrong with the use of drain tubes. I can use a drain tube as competently as any other professional embalmer. It's just not what I prefer to use. And finally, utilizing continuous flow of water over the embalming table to rinse loose chemicals. You should always have water running so that anything that hits the table gets pushed down the drain. Keep the lid on hazardous waste containers. I see a lot of people like to go ahead and take the hazardous waste container, lift the lid up prior to embalming, and then just start throwing things in, airballing it from the table. I've seen that done. One, when those things get, a couple days worth of bad diapers and body bags in there, no one wants to be sniffing that. Nobody wants to be sniffing that. Cover all your sinks and flush basins. Okay? You're going to have a pipe that goes into your flush sink. You're going to cover the area around that pipe with plastic so that when stuff goes in and it drips and it hits the water, it's not splashing outside all over the floor, or a formaldehyde fluid from an autopsy embalming is going in there. It's not aerosoling from there. Yeah, your ventilation is going to go a long way to keep you comfortable and keep you safe, but if you don't want to sniff it, if you don't have to. Examples of engineering controls for compliance with the formaldehyde standard are essentially the same for biological hazards. Now, the National Funeral Directors Association is a wonderful organization. Proud to be a member of it. They do great work. They've drafted a set of environmental health and safety practices that all practitioners should adhere to, and their recommendations are on their website. If observed conscientiously, these practices will help you meet the highest standards of professional excellence. First, secure your prep room. This is an access-sensitive area, so you're going to want to have key cards, locks, something so that ingress and egress is only available to people who need to have it. Evaluate your exposure risks. Know the type of products you're using. Prepare for emergencies. Make sure you have spill kits. Make sure you have accessible telephones in case someone gets something in their eye and they're by themselves. And limit toxicity and waste. Avoid solvents and chlorinated compounds. Formaldehyde is not the only nasty thing with vapors we work with. Know how to manage your wastewater. Handle your sharps carefully. And think before you flip the switch. Don't just toss it in the trash. If possible, recycle. Keep things clean and document your work. Now, between this chapter and the fourth chapter, there is an appendix with a bunch of stuff in there, okay? Anything to do with safety data sheets is testable. Hate to break it to you, okay? Material safety data sheets went away in 2012 when they implemented a new international standard called Hazard Communication 2012 or HAZCOM 2012. The big difference is prior to HAZCOM 2012, a safety data sheet just had to have the information on it, or the material safety data sheet. Material safety data sheet had to have the material on it. It did not have to be in a certain order. Safety data sheets have 16 sections. They are uniform, so if you go to any one section, you'll know exactly what's supposed to be there. Sections 1 through 8 contain potential information about the chemical, identification, hazards, composition, safe handling, and emergency control measures. 9 through 11 and 16 contain information about the physical and chemical properties, reactivity, exposure control, etc., etc. And finally, the regulatory information about when the sheet was last edited, stuff like that. 12 through 15 are included to be consistent with the United Nations globally harmonized system of classification and labeling of chemicals, or the GHS. Now, OSHA does not enforce the GHS, okay, because that is a United Nations thing. OSHA looks at everything but 12 through 15, okay? Other agencies will handle 12 through 15. So section 1 is the identification and identifies the chemical and safety data sheet as well as its recommended uses and provides contact information for the supplier. Section 2 identifies the hazards. Okay? Section 3 is information on ingredients. It identifies the ingredients or the different types of impurities and additives that may be in there that you are concerned with. This section includes all information on substances, mixtures, and all chemicals where a trade secret is claimed. So if there is a trade secret, it'll be listed as such, and you will be required to call an 800 number to get more information about whatever it is you're dealing with. Section 4 is the first aid measure, so that if you are waiting on first responder or you are a first responder, you are an untrained individual that can give certain things to that person at that time. This is why it's important that, one, you immediately know what you need to do. Induce vomiting, do not induce vomiting. Stick their heads into the eye wash station, don't let them move for 10 to 15 minutes. Dial the 800 number, contact the EMTs, get people down there. When they show up, you've got it on the phone that, you know, hey, this is what you folks need to do. This is the type of chemical you're dealing with. Here's the type of compounds. Get them to the hospital, etc. Section 5 is firefighting measures. That way, if something happens and you're dealing with flammable materials, you know whether you should be using either foam or water or what the heck. Section 6, accidental release. Okay, this provides recommendations for what happens when you have spills, leaks, or etc. So, for instance, if you were to spill formalin solution, you are likely, in this section, section 6, you're probably going to have information about, hey, you should probably get some ammonia, spray that on there. That will help neutralize the chemical. Don't be using bleach for that. Section 7 is handling and storage. This section provides guidance on the safe handling practices and conditions for the safe storage. Again, for a formalin-based solution, you're probably going to be looking at moderate temperatures, not lots of sunlight, stuff like that. Section 8 contains exposure limits, engineering controls, etc. So it's going to tell you things. If it was formalin solution, it would tell you about the action level, 0.5 to 0.74, the short-term exposure, etc., etc., etc. Last 9 physical and chemical properties, self-explanatory. 10, stability and reactivity, tells you how quickly it can go from oh nothing to oh god. 11 is toxicological information. It identifies toxicological and health effects information, indicates that such data are not available, which may be the case if it's a new chemical. You don't know until you read the SDS. Finally, we're up to the globally harmonized system, the UN stuff. Ecological information. We have the disposal considerations. We have transport information. And then on 15, we have regulatory information. Okay? Identifies safety, health, and environmental regulations specific for the product that is not indicated anywhere else in the SDS. And finally, 16, this indicates whether the SDS was prepared or when the last known revision was made. The SDS may also state where when changes have been made to previous versions. So they may give you, hey, we clarified this, we did this based on that. Employers must ensure that all safety data sheets are readily accessible to employees for all hazardous chemicals in the workplace. No ifs, ands, or buts. Employers should designate a person responsible for obtaining and maintaining the safety data sheets. This is typically your prep room manager, although it might be the general manager of the entire firm. If an employer does not have a safety data sheet, they should contact a manufacturer or distributor to obtain one. You are under an obligation, okay? You as the employer are under an obligation to get the safety data sheet. You can't just say, hey, they didn't send one. You need to call them. You need to get on their website. If there is not one, you should get something from the manufacturer or the supplier saying, hey, one is in print or one is not available or what the situation is. Don't let it be ignored. And just because you've gotten no response, hey, one's not available, doesn't mean you forget about it. You should probably follow up. When you go ahead and you review your binder, you might want to contact them again. So with hazardous chemicals, every list, this is the second appendix, it's between chapters 3 and 4. Every chemical on this list is testable. Some information worth formaldehyde we're going to talk about right now. So, first of all, concentrates to 0.5 to 2 parts per million. Irritation of the eyes, nose, and throat of some individuals. So we already know that that OSHA says that, hey, if you're at the action level, if you're at that 0.5, you need to start taking steps. And if you're at 0.75 on an 8-hour test, you need respirators. At 2.0, you need respirators. At 3 to 5 parts per million, which is way over anything that we should be dealing with, you have tearing of the eyes, and it's intolerable to some person. They simply can't be in the room. 10 to 20 parts per million. Difficulty in breathing, burning of the nose and throat, cough, and heavy tearing of the eyes. By 25 to 30 parts per million, you now have damage to your respiratory system, leading to pulmonary edema and pneumonitis. Now, at 25 to 30, okay, when it says pulmonary edema and pneumonitis, you can die from that, okay? You can die from that. This is where you get something what's known as embalmer's pneumonia, okay? This is horrible. I caught this after working on a prep for 3.5 hours and spending a full day in the prep room. And I thought I was coming down with a cold. 3 hours after I left work, I felt like I wanted to die. It was hard to breathe. And the only thing you can do, folks, the literal only thing you can do is you have to wait for it to wear off. There is nothing you can do to accelerate it. They can slap oxygen on you, help you breathe better, but there is nothing that anyone can do except wait for it to wear off. And when you reach 100 parts per million, you're dead. When they say immediately dangerous to life and health, that means you're dead. If you are exposed to this, you're dead. This is really dangerous stuff. This is why we spend a lot of time in mortuary school talking about how to protect yourself from it, what the warning signs are of exposure, why you're going to be likely tested on this on your national board exams, why you're going to get trained on this annually going forward. This is important stuff, folks, all right? So this is Professor Finn signing off. We're going to see you next video. Y'all take care.